Sickle cell disease is one of the most painful and destructive conditions I have ever experienced with a patient. There are now two new FDA approved treatments that may be curative of this terrible genetic disease. So let's talk about it. Hey everybody, it's Dr. David. So, back in my days at Tampa General in the mid 90s, working in both the hematology clinic, but also having patients being admitted through the ER to the floor to the ICU, I had a lot of experience working with sickle cell disease, which is a hereditary blood condition. And it overwhelmingly affects people who are Black. 93% of people who have it are Black. There's about 100,000 people in America who have the disease. Now, about 5% of people are Hispanic and 2% are white. So a lot of people, although they think of it as a disease just for Black people, that's not actually true. Okay, other people can get it, but obviously if a person's white, a doctor probably won't be even thinking about it, but it is good to know that it exists. Okay, now there are these two new medications, gene therapies, that through different ways slightly are changing around the genetics of the person who has it and making it so that their cells don't sickle anymore. Okay, now let's first talk about what that means. So red blood cells normally have this like discoid type of shape to it. And because of that, they're nice, smooth around, they make their ways through blood vessels, etc. But when cells sickle, so hemoglobin A is the most common hemoglobin that we have as adults. There's a hemoglobin F for fetuses that you see at babies, but then it's supposed to move to A. But there is a sickle cell S. Now, this is a dominant disease. This is a recessive disease. So there could be sickle cell trait if a person has just one copy of the gene, and they may have some mild anemia, but they don't typically go into these painful crises. Okay, but if you have two copies, then you have sickle cell disease, not just the trait, and that is what's really, really tough on a patient. Okay, and so what happens when these cells, not only can they lodge into the blood vessels and the capillaries, but they also can clump together. Okay, and this can lead to clots. They can lead to breakage and damage of the blood cells. It can starve tissues of oxygen and can lead to those types of terrible diseases, infarction, lack of blood flow to wherever it may. So it can go to the heart, it can go to the brain, it can go to the spleen, to the liver, and it can kill those cells off due to lack of blood supply. It also, in particular, to the spleen. They can gather in the spleen because the spleen is where we gather and how we kind of process, we dispose of our red blood cells and recirculate them. But these sickle cells can lodge in the spleen and can destroy the spleen. But when that happens, it can make people particularly susceptible to certain types of bacterial infections, which can make it much more difficult because they may have problems with like these problems in their lungs and they have low oxygen, and then they can get a pneumonia, and then that just complicates the symptoms as well. And the more deprivation of oxygen, then the more the cells sickle. So it's almost like it's a cycle. It's a vicious cycle that can just be absolutely, and when it goes into the bones, and that's another really serious, it can cause these bone infarctions and bone pains, and they can just have the most terrible, terrible bone pains. Probably the thing that I've used the most medicinal, pharmaceutical opioids on have been with people who have sickle cell disease, because sometimes it's the only thing that will work for them. Okay, now, these two FDA-approved medications. The first one, and the one that's been getting a little bit more of the headlines, is called Casgevy. Okay, and this was approved for people who are 12 years old and older. And it's the first medicine that is used using what's called the CRISPR gene editing technology. Okay, so way back when we had the human genome that was coded and identified, that was the predecessor to learning how can they edit genes. And there's a technology where literally they can do that into stem cells. And so the nice thing about this, and as well as the other one, is you do not need a donor. It's using their own stem cells. It's just changing them around. Okay. And so this is probably going to help a lot of other genetic diseases in the future. Pardon me. The inventors of this technology back in 2020 received the Nobel Prize in chemistry for this amazing, amazing discovery. And the main study that was quoted in order to give the FDA approval, they looked at 46 participants. And 30 of them had received follow-up care and observation. And of those, 29 of them responded well to the treatment, which is obviously really good because you can't do follow-up for everybody. But the thing about it is that at this point in time, it costs $2.2 million for one patient. And that doesn't even include the hospitalization and all the other things that I'm going to talk about. So, God willing, they're going to figure out a way to make this cheaper, accessible. Insurances will pay for it because, of course, not too many people have $2.2 million laying around. And unfortunately, because since this is often in populations, more commonly in populations who are underserved, there could be a little the financial issue of as well, and the disproportionality of healthcare as well. So that's why this is a difficult thing. But in order to prevent the sickling, what this medication that Casgevy does is it modifies the DNA in the patient's stem cells. And of course, as you may know, stem cells are the building blocks for all of our other blood cells, white blood cells, red blood cells, platelets. It all comes from stem cells, as well as other things that people are using in regenerative medicine. And so what they first have to do is they do about 3 to 4 months of blood transfusions, getting as much other people's blood, healthy red blood cells, into the system so that the circulation can be up and going, and that we don't have to worry so much about if there are some sickling cells, but there's still plenty of oxygen, then there's not going to be that type of pain and all of those other symptoms. Okay. But then after those 3 to 4 months, they will harvest, they will take out from the bone marrow the stem cells from the patients, and they will harvest them. Okay. They go to the lab, but as part of the harvesting, before they do it, they use this CRISPR technology to edit the DNA in all of those cells, and then they grow them with the healthy DNA in it. Okay. Now, before they're able to give the stem cells, they actually have to clean the blood of all of the defective cells. And also the defective DNA that's still in the stem cells. So they have to then undergo chemotherapy, which of course that can be really rough on people too. But they'll typically go through this chemo to kill off their bone marrow. Now, because of this, they have to spend 1 or 2 months in the hospital. They're immunodeficient. Also, once the stem cells are then put back into the body, they need to then proliferate. Okay. And that takes some time before they can truly build up to the amounts that gets to where they need to get to in order for this to be a long-term cure. Okay. So, and so again, actually, it's 1 to 2 months after all of those things are settled down before they do the infusion. And then, of course, they have to stay in the hospital for longer after that. Now, there is another similar medication called Lyfgenia. And this was not using CRISPR. It was using a similar type of technology, but it's a gene therapy as well. It does work in a similar way. And in their research, which also got the approval, 28 out of 32 patients were completely cured and had no more sickling crises whatsoever. Another 2 stopped having sickling crises, but they still had some minor events. Okay. But the issue with this one is 2 of the people did develop leukemia. And so that's why that one's, it's out there in terms of available. And of course, we always tell people, pro versus con of everything. But, and of course, that's 2 out of 32. This isn't hundreds or thousands of people that were studied. So, of course, it could have been a coincidence. But 2 out of 32 is, after a treatment is done, is probably not. But again, there's other things in life that we can take care of. That we can't take care of. So, again, just something to keep in mind. Okay. Now, the current trial that they're doing is going on for 2 years. So that way they can continue to follow along. But also, that means that they don't quite know about long-term effects, right? And of course, there are people out there who are in such severe pain, just like when people take chemo, even though they know about the long-term effects, they'll still do it because their life is so miserable or life-threatening, etc. Okay? Now, one of the things that was discussed at the FDA approval committee, and this is something that they seem to have a little bit more evidence with the Lyfgenia version, is what is called the possibility of off-targeting of the DNA. So what this is it possible that the gene editing technology, instead of going after the specific gene that it's supposed to, could it go after other genes? Could it affect other DNA with, of course, potentially unknown consequences if editing of other genes, potentially an important gene, was seen? So far, again, this 32 not seen, but again, longer-term research is going to say whether this is a possibility. And of course, the FDA says that you should take this into account when weighing the pro versus con, because of course, that's what should happen. Okay, so in terms of my final thoughts on this, first of all, I think that this is an absolutely amazing breakthrough. and I really look forward to seeing where over the next couple of decades where this is going to go, because again, it's just amazing that they were able to come up with this in the first place. And I think that this is going to be a 1.0 version for this. Yeah, they'll be doing for other diseases as well, but probably over time, over the next couple of decades, they'll be able to tweak it and maybe even make it more effective or less side effects. That's usually what they do with medications. Now, again, hopefully we will continue to see these other breakthroughs, but goodness gracious, if they can figure out a way to make this accessible and affordable to people, there could be hundreds of thousands of people, at least 100,000 people who are active right now, but also people in the future who may not suffer from this incredibly debilitating disease. Have a nice day.